Hmm. Hey, Dr. Amy here. Salut. Welcome back to a coffee talk. This coffee, real quick before we begin on today's topic. HEB Texas Pecan, my best friend sent this to me and I just AeroPressed it, and oh my gosh, it is like nice and dark. Cool. Awesome. Obviously this is a coffee talk, so the concept is to drink coffee while I'm talking about a topic. And today's topic, I was thinking of a good title for this, and I think the best title would be medical hopping. What does that mean? So when working with patients, and I have actually witnessed this, and even a little bit outside of hopping around from medical physician or healthcare provider, I don't want to be mean about this subject, but I think there comes a point of with medical hopping that something is being sought out from the patient perspective because they want to hear what they want to hear. So from the physical therapy standpoint, if an individual comes to me and they say, I'm going to the massage therapist, I'm going to the chiropractor, I am going to a stretching specialist, I'm going to my medical physician who is also writing me prescriptions, I am going to a orthopedic specialist because this shoulder pain just won't go away, or my back pain just won't get better because I can't enjoy the things that I love to do, like working out or returning to an overhead squat. And you have this medical hopping that occurs, and everybody's putting their 2 cents into what might be going on. So it's kind of like this, where you have too many marshmallows roasting in the fire, right? So an individual or a patient may experience this plateau where they're not getting better. They might be getting worse, but they're certainly not getting better. So they seek out medical attention. They medical hop or healthcare hop. But in order to get better, you have to try a thing for a little bit in order to see its effects down the road. So as far as medical hopping happens, and now this is pertaining to, I want to be clear on this, musculoskeletal issues. So those are the common things that I see when I work with patients, that if you medical hop to all of these healthcare providers and they're, doing this for you or telling you to do that, you don't know really what is working, right? You are seeking out services because you think it may be beneficial to you. So when it comes down to this, hang on. Here's my thought. If you're going to do the thing and keep the thing the main thing, you have to do one thing, right? Maybe two, but one thing in order to see the effects from it. It's like where there might be an individual that you may know who, when you're training and exercising, they're program hopping, like they're in the hopper, right? They're just randomly going to these gyms, and they're not seeing progressive overload or improvement in their overall fitness and even health metrics. So you're going to all of these things on the map, right? But nothing's really like truly mapped out for you. So medical hopping or healthcare hopping should be viewed as avoiding the Medicare or the medical system, right? We don't want to go down that medical system route. So finding a specific healthcare provider, in this case, physical therapist, if someone comes in with a shoulder niggle or maybe they do have leg pain, they need to get a proper assessment, right? 8 times out of 10, this does not need to be intervened into a medical system. So if there is a physical therapist who really can assess and get down to the possible originator of what's going on, then I would vouch for staying with that particular individual for a little while to see if you're feeling better, you're sleeping better, you're getting daily movement, your nutrition is better, you're not as lethargic, right? You're getting back to the gym. The movements that you were not doing that were painful aren't painful anymore, right? You're building your tolerance back up. Your physical therapist is guiding you down the right pathway. So medical hopping essentially becomes this snowball where you or a patient perhaps kind of wants to hear what they want to hear from the medical professional. So when it comes to musculoskeletal care, we want to try to keep you out of the medical system. We want to prevent you from medical hopping. So really trying to figure out where that physiotherapist is, or that massage therapist, or that chiropractor, or exercise physiologist, or CrossFit coach, right? That they understand what's going on, but knowing when referrals need to be out appropriately. So medical hopping is not necessarily in my eyes, a proper path to walk down, unless it's something that's out of the scope of a physical therapist's realm, where, hey, I think you need to see an orthopedic, or hey, I think you need to go see a orthopedic who specializes in shoulder, right? So that they can get pictures on the shoulder, etc. So hopefully that kind of gives you an idea of what medical hopping entails, and trying to keep the main thing. Try one thing for a while, be patient, see if it works, see if it changes and gets you back to the gym, get you back to moving again, before you medical hop to another healthcare provider. So it's just my 2 cents, but HEB, pecan, Texas pecan, oh my gosh. Salut, and we will see you on the next Coffee Talk.